Did you know that your skin, nails, and even your breath could be revealing hidden clues about the health of your liver? Liver disease is far more common than most people realize. I see it every single day in the hospital, and a lot of the time, the early signs are missed. Today, I'm going to show you the top 12 signs of liver disease so you know what to look out for, from your fingernails all the way to your brain. Alright, first, take a look at your fingernails. It's amazing how often changes in your health show up right here. Do you see these horizontal white lines across the nail bed? These are called muex lines. What's interesting is that these lines are actually on the tissue underneath the nail, not on the nail itself. A cool way to check is if you apply pressure to the nail, they'll temporarily disappear. This happens because of a drop in a protein called albumin, which is made by your liver. When your liver isn't working well, albumin levels can fall, causing these lines to appear. Here's another nail finding called Terry's nails. If you look at your nails and they seem almost completely white or pale, and the little half-moon shape at the base, called the lunula, is missing, it could be a sign. It's often described as looking like ground glass. Just like mucus lines, Terry's nails are also linked to low albumin levels, pointing towards a potential liver issue. Now, here's a test you can try yourself, called the clubbing test. Put your 2 index fingernails together, like this. You should see a little diamond-shaped window between them. If you don't see that gap, it could be a sign of nail clubbing, which is associated with a number of health conditions, including severe liver disease. Now, look at this woman's belly. At first glance, it might look like pregnancy, but this is actually a buildup of fluid in the abdomen called ascites. It's a classic sign of advanced liver disease. Shockingly, the abdomen can stretch and fill with upwards of 15 liters of fluid. That's a huge amount. So why does this happen? Well, when the liver is scarred from conditions like cirrhosis, it causes pressure to build up in the main vein that leads to the liver, the portal vein. This condition is called portal hypertension. Because of this extra pressure, huge amounts of fluid leak out from the blood vessels and collect in the abdomen. When I was in residency, I'll never forget doing a procedure called a paracentesis to drain this fluid for a patient. We insert a needle into the abdomen and let the fluid drain out. It's a temporary fix, but it provides a lot of relief. Here's a video of me doing one. You can see the fluid is this yellowish color. It's a very common procedure we do for patients with advanced liver disease, but it really highlights just how much fluid can accumulate. Portal hypertension doesn't just cause fluid buildup in the belly. It also forces blood to find new pathways around the blocked liver. This rerouting can cause tiny veins that are normally invisible to swell up and become visible on the surface of the skin, especially around the belly button. This pattern is called caput medusae, which is Latin for head of Medusa, because it kind of looks like the snakes on Medusa's head. It's a very striking and specific sign of portal hypertension. These swollen veins, called varices, can also form internally, like in the esophagus, and they can be very dangerous if they rupture and bleed. Let's move on to the skin. Have you ever noticed redness on someone's palms, specifically on the fleshy parts at the base of the thumb and the little finger? This is called palmar erythema. It affects the area over the vena and hypophonar eminences. It is thought to be caused by changes in hormone levels that happen when the liver isn't functioning properly. Another skin sign is something called a spider nevus, or spider angioma. It's a central red spot with little reddish vessels radiating outwards, like a spider's legs. If you press on the center, it'll turn white, and when you release, it fills back up from the center. While having 1 or 2 can be normal, if you have 3 or more spider nevi, it would definitely make me start to wonder about liver disease. Next is muscle wasting. With chronic liver disease, you can see a significant loss of muscle mass. An easy place to check is on the hand. Look at the muscle between your thumb and index finger. If that area looks sunken in, it could be a sign. You can also look at the temples. If they look hollowed out, that's another area where muscle wasting is prominent. Why does this happen? Because the liver is a powerhouse. It processes nutrients from your food, makes proteins essential for building muscle, and stores energy. When it's sick, your body can enter a state of malnutrition, even if you're eating enough. Another hand sign is Dupuytren's contracture. Try this. Lay your hand flat on a table. If you can't completely flatten your hand because one or more fingers are bent towards your palm, that could be a sign. It's a thickening of the tissue under the skin of your palm. One of the more alarming signs is something called hepatic encephalopathy. This is when toxins, particularly ammonia, build up in the blood because the sick liver can't clear them out. These toxins then travel to the brain and can cause confusion, personality changes, and a distinctive physical sign called asterixis, or a flapping tremor. If you ask someone to hold their hands out like they're stopping traffic, their hands will involuntarily flap back and forth. The reason ammonia builds up is tied to our gut. Gut bacteria produce ammonia, which is normally detoxified by the liver. I had a patient once who came in extremely confused. It turned out he hadn't had a bowel movement in 3 days, causing a huge backup of ammonia that his liver couldn't handle. Treating his constipation actually helped clear his confusion. Perhaps the most well-known sign of liver problems is jaundice. This is when your skin and the whites of your eyes turn yellow. This happens because of a buildup of a yellow substance called bilirubin. Bilirubin is a waste product from the breakdown of old red blood cells. A healthy liver processes bilirubin and gets rid of it. When the liver is damaged, bilirubin accumulates in the body, causing that yellow discoloration. Finally, easy bruising and bleeding. Your liver produces the proteins needed for your blood to clot. If your liver is impaired, you might notice you bruise very easily, or that small cuts bleed for a longer time than usual. This is a direct result of not having enough clotting factors in your blood. So, what can you do to protect your liver? The good news is the liver has an amazing ability to regenerate. The most important things are to maintain a healthy weight, eat a balanced diet, exercise regularly, and limit alcohol consumption, as it's a direct toxin to liver cells. If any of these signs sound familiar, it's really important to talk to your doctor. They can run simple blood tests to check your liver function. If you enjoy learning about signs of disease you can see just by looking, check out this video next where I talk about the hidden signs of heart disease. Thanks for watching, and I'll see you in the next one.